Audiobook, Listen to Your Body. Signs and Symptoms of Ailments and Diseases. By Milco Baute. Written and published in 2023. The human body is a perfect machine, but it has an owner who can be ignorant. The human body is designed to defend and heal itself, but it will only achieve this with our own help. Preface. As a disseminator and researcher, I have taken it upon myself to gather and share well-informed perspectives on health, well-being, and abundant living. These are topics I've explored in some of my other books, which are listed at the end of this volume. It's worth noting that I am not a medical doctor and lack any formal doctoral credentials that would empower me to speak on my own authority. Within the pages of this book, you will discover some of the most common diseases that affect both men and women, along with their associated symptoms. My intention is to equip you with the knowledge you need so that you can take prompt action before it's too late and an ailment becomes chronic or a threat to your life. If you desire to learn more about how to better care for your health or even reverse an existing condition, I recommend my book, How to Heal Cancer and Other Ailments, or any of my other works on natural medicine. It is imperative that you always consult with a medical professional if you experience any of the symptoms outlined herein. They can provide guidance on necessary laboratory tests to ascertain the nature of your condition. The material presented here is intended for preventive purposes, rather than curative. Understanding how to listen to and attend to the signals your body sends will enable you to better care for your health through your lifestyle choices and, if necessary, to take measures to mitigate damage. I hope this work serves as a guide to help you appreciate the importance of safeguarding your health and adopting an appropriate lifestyle. Introduction. The body may not speak, but it issues warnings and alerts through signals of pain, marks, blemishes, color, and odor. These signals serve as reminders of our neglect toward our own bodies, which we, out of ignorance, pleasure, or caprice, gradually harm and ail until it's too late to reverse the damage, the illness, or the cancer. Let's learn to recognize these warning signs that our bodies send or exhibit, so that we may become aware of the harm we are inflicting upon ourselves. Do not wait until it's too late, because as it said, we know that God does not listen to sinners, but if anyone is a worshipper of God and does His will, God listens to him. John 9 verse 31. Take care of your body, the vessel or means of transport that God has given you to inhabit the earth, because prayers will not deliver you from your own negligence. This is why many believers are not healed, or after being healed, they relapse into illness or a health condition that afflicts and limits them. For, do you not know that your bodies are temples of the Holy Spirit, who is in you, whom you have received from God? You are not your own, you were bought at a price. Therefore, honor God with your bodies. 1 Corinthians 6:19. If anyone destroys God's temple, God will destroy him, for God's temple is sacred, and you together are that temple. 1 Corinthians 3:17. Listen to your body, the lament expressed as pain of any kind, head, mouth, throat, muscles, abdomen, back, sides, legs, feet, fingers, nails, ears. Examine your skin for blemishes, rashes, foul odors, or itching. Check your urine for color, thickness, frequency, pain, or burning. Do the same with your stool. Even the color of your earwax can indicate a bodily condition. Any of these signs may indicate that you are beginning to suffer from a medical condition or an imbalance in your organs or blood, a disorder, or an infection. When you notice any of the symptoms mentioned in this book, seek a medical professional to undergo laboratory tests. If you lack medical insurance and need it to receive care, consider paying for it without hesitation. Plan ahead, because we tend to spend more on things that harm our health than on solutions to reverse the damage caused by our negligence or ignorance. Then, take the necessary measures, adopt a suitable diet, stay hydrated, engage in exercise, try home remedies, and as a last resort, consider medication to help control the damage. It's well known that these medications do not cure diseases and often lead to other harm and adverse reactions. In my books, How to Live a Long and Abundant Life, and How to Heal Cancer and Other Ailments, I share advice and remedies for maintaining mental, physical, and spiritual health, preventing diseases, or reversing them naturally. Diseases represent imbalances within the body, with the true congenital ones being those present at birth. Viruses. For millions of years, microorganisms such as parasites, bacteria, fungi, viruses, molecules, and a whole array of microscopic and subatomic entities have existed. God is wise, and even though there are wicked individuals who experiment with the health of animals and humans, capable of intentionally causing the death of millions, God remains in control. He selects wise and courageous people to confront these heartless, unscrupulous, and morally bereft entities, groups, and individuals. They speak the truth and provide assistance to humanity, our lands, our history, and our planet. Viruses have always been under control, whether they are natural, artificially created, or cloned in laboratories. There is always a cure for every ailment. The symptoms of a virus can vary depending on the type of virus and the individual affected. Some common symptoms may include fever, dry cough, headache, body aches, fatigue, sore throat, nasal congestion, difficulty breathing, loss of smell or taste, nausea and vomiting. It's important to note that these symptoms can range from mild to severe, and some individuals may remain asymptomatic. If you exhibit virus symptoms, it's crucial to take precautions to prevent the virus's spread. This includes staying at home, wearing a mask, and frequent hand washing. If your symptoms worsen, seek immediate medical attention. I can't enumerate all existing viruses, as there are thousands of them, and new ones are continually discovered. Furthermore, many viruses may have very similar symptoms. However, I will present some common viruses and their symptoms. Influenza, flu fever, headache, muscle pain, cough, nasal congestion, and sore throat. Common cold virus, nasal congestion, sore throat, cough, sneezing, and headache. Herpes simplex virus, painful blisters on the mouth or genitals, itching, and fever. Human papillomavirus, HPV genital warts, cervical cancer, and other cancers. HIV, fever, night sweats, fatigue, weight loss, diarrhea, headaches, muscle aches, and sore throat. Hepatitis virus, fatigue, abdominal pain, loss of appetite, nausea, vomiting, and fever. It's important to emphasize that these are just a few examples of common viruses, and symptoms can vary widely based on the virus type and the individual affected. The symptoms of COVID-19 can vary in severity and manifest differently in each person. Some of the most common symptoms may include fever, dry cough, shortness of breath or difficulty breathing, fatigue, headache, loss of smell or taste, sore throat, muscle aches or body aches, chills or tremors, nasal congestion or runny nose. Less common symptoms, such as nausea, vomiting, and diarrhea, have also been reported. It's essential to recognize that some patients with COVID-19 may be asymptomatic. Therefore, it's crucial to follow the guidance of health authorities to prevent virus transmission, such as wearing a mask, frequent hand washing, maintaining social distance, and avoiding gatherings in enclosed spaces. If you suspect you may have COVID-19, seek immediate medical attention. How to effectively avoid contagion of a lethal virus like SARS-CoV-2 coronavirus. The most effective way to protect yourself from a viral disease is to prevent infection. This doesn't necessarily mean relying solely on a savior vaccine, wearing a mask or face covering all the time, or isolating and confining yourself due to fear of contagion, which could be more harmful in many cases or over extended periods. The most effective methods are as follows. Maintain personal hygiene, wash your hands and face frequently, especially after returning from public places. Avoid touching your face. If you must touch your face when outside, carry a small bottle of hand sanitizer to disinfect. Use hygienic wipes or sanitizer. Carry sanitizing wipes or hand sanitizer and use them every time you leave a public space, whether it's your workplace, stores, supermarkets, restaurants, etc. Promptly and thoroughly clean your hands. Proper mask usage. In times of epidemics or pandemics, if you use a mask indoors, use it correctly and only when necessary. Misuse can be counterproductive and potentially increase contagion since viruses, germs, and bacteria can easily be inhaled and end up in your nose or eyes. Prolonged mask use is unnecessary for a controlled virus. If you are compelled to use one, then opt for daily changes and ensure proper placement. Outdoors, it is better to remove your mask to breathe and enjoy the oxygen, sunlight, and the benefits of the nature God created. Diet and nutrition. Eat healthily, avoiding excessive sugar, alcohol, carbohydrates, red meat, and fried foods. Overindulgence in these can lead to heart problems without your notice, deteriorating your organs and immune system. Daily food intake typically lacks all natural ingredients for health benefits, as most are inflated, treated, medicated, processed, and altered. Reinforce your diet with vitamin C, D, B, E, and other natural elements. Don't forget to drink enough water daily. Make these practices a part of your life, and you'll experience a healthier and safer life, even in the face of endless, manipulated, and disinformation-driven pandemics, like the one we're currently experiencing and those that may follow. Hereditary diseases. There are many hereditary diseases, and here is a list of some of the most common ones. Hemophilia, a disease that affects the body's ability to clot blood. Huntington's disease, a condition that leads to the degeneration of the brain, resulting in motor, emotional, and cognitive problems. Cystic fibrosis, a disease primarily affecting the lungs and digestive system, causing the accumulation of thick mucus in these organs. Down syndrome, a genetic condition causing physical and mental development delays. Sickle cell anemia, a disease that leads to the production of abnormal red blood cells and may result in pain, infections, and other health issues. Tay-Sachs disease, a condition leading to the accumulation of toxic substances in the brain, resulting in developmental and cognitive problems. Gaucher's disease, a condition affecting the body's ability to break down certain fats, leading to the buildup of these fats in specific organs. Muscular dystrophy, a disease causing muscle weakness and loss of muscle mass. Symptoms of each hereditary disease can vary widely and may include physical, cognitive, emotional, and behavioral issues. It is important to consult with a medical professional if there is a suspicion of having a hereditary disease or a family history of these conditions. Congenital diseases. There are many congenital diseases, and it would be impossible to list all of them and their symptoms in a single message. Some of the most common congenital diseases include Down syndrome, distinctive facial features, cognitive delay, weak muscle tone, heart and gastrointestinal problems. Spina bifida, an opening in the spine, muscle weakness, bladder and bowel control problems, hydrocephalus. Cleft lip and palate, an opening in the upper lip and or palate that can cause difficulties in eating, speaking, and breathing, as well as breastfeeding, speech, and eating, along with other dental and ear problems. Cystic fibrosis, chronic cough, frequent respiratory infections, breathing difficulties, failure to thrive, digestive problems, poor nutrient absorption, and other symptoms. Huntington's disease, coordination problems, involuntary movements, difficulty swallowing and speaking, personality changes. Sickle cell anemia, joint and abdominal pain, fatigue, jaundice, frequent infections. Sickle cell disease, pain, fatigue, leg ulcers, frequent infections, and other symptoms caused by abnormal blood cells. Phenylketonuria, intellectual disability, seizures, behavioral problems, and other symptoms caused by the accumulation of phenylalanine in the body. Congenital hypothyroidism, poor growth, dry skin, constipation, lethargy, and other symptoms caused by an underactive thyroid. Congenital heart disease, breathing difficulties, blue skin color, feeding problems, and other symptoms caused by heart issues. It's important to note that each congenital disease is unique and may have a variety of symptoms and severity. If you suspect that you or someone you know may have a congenital disease, it's important to seek medical attention for an accurate diagnosis and appropriate treatment. Deformities. Deformities can be caused by various diseases that affect different parts of the body. Some of these diseases and their potential deformities include rheumatoid arthritis. This autoimmune disease can lead to deformities in the joints, such as twisted, swollen, and distorted fingers and toes. Scoliosis. This condition is characterized by an abnormal curvature of the spine, which can result in a hunched posture or asymmetry in the waist or shoulders. Clubfoot. It is a congenital deformity of the foot in which the foot is twisted or turned inward, making walking difficult. Paget's disease. This bone disease can cause bone deformities, such as an enlarged femoral head or an abnormal curvature of the spine. Cystic fibrosis. This genetic disease can cause bone and limb deformities, as well as growth and developmental delays. Multiple sclerosis. This autoimmune disease of the nervous system can cause muscle spasms, muscle weakness, and coordination problems that may result in an unsteady or staggering gait. Melanoma. This type of skin cancer can cause deformities in the skin, such as changing color, size, and shape, and the development of lumps or bumps. It is essential to note that not all diseases lead to deformities, and in some cases, these deformities can be corrected through medical or surgical treatment. Obesity. What is obesity, and what are its symptoms? Obesity is a chronic disease characterized by an excess of body fat. It is considered obesity when the body mass index, BMI, is equal to or greater than 30. Some of the symptoms of obesity may include weight gain. Weight gain is one of the most evident symptoms of obesity. Difficulty breathing. Obesity can make it difficult to breathe, especially during physical exercise. Fatigue. Obese individuals may frequently experience tiredness or fatigue. Sleep problems. Obesity can lead to sleep apnea, insomnia, and other sleep disorders. Skin issues. Obesity can cause skin problems, such as acne and skin rashes. Digestive problems. Obesity can increase the risk of digestive diseases such as gastroesophageal reflux disease, GERD, inflammatory bowel disease, and gallbladder disease. Joint problems. Obesity can cause joint pain, especially in the knees, hips, and lower back. Belly or abdomen. Having a prominent belly can indicate an excessive accumulation of fat in the abdominal area, known as central or abdominal obesity. Abdominal obesity is a risk factor for cardiovascular diseases, type 2 diabetes, high blood pressure, metabolic syndrome, and some types of cancer. Additionally, having a prominent belly can also impact one's self-esteem and body image. It is essential to maintain a healthy lifestyle, including a balanced diet, regular physical activity, and avoiding excessive alcohol and tobacco consumption to prevent abdominal fat accumulation and improve overall health. It's important to seek medical assistance if you experience any of these symptoms. Obesity can increase the risk of chronic diseases such as diabetes, heart disease, and high blood pressure. Maintaining a healthy diet and regular exercise can help prevent obesity. Insulin resistance. Insulin resistance is a condition in which the body has difficulty using insulin effectively, which can lead to elevated blood sugar levels and eventually to type 2 diabetes. Some symptoms that may indicate insulin resistance include weight gain, especially around the waist. Fatigue and lack of energy. Sleep problems, such as sleep apnea or insomnia. Skin issues, like darkening of the skin on the neck, armpits, or elbow folds. Fertility problems in women. Increased levels of cholesterol and triglycerides in the blood. High blood pressure. It's important to note that many people with insulin resistance may not experience symptoms and may not be aware that they have the condition. This is why regular health checkups and blood glucose tests are recommended to detect insulin resistance and prevent more serious health problems in the future. Diabetes. Diabetes is a chronic disease characterized by elevated blood sugar levels. Some of the most common symptoms of diabetes include excessive thirst. if you have diabetes, your body may lose too much water while trying to eliminate excess sugar in the blood. As a result, you may experience unusually intense thirst. Frequent urination. You may also need to use the bathroom more frequently if you have diabetes, as your body tries to eliminate excess sugar through urine. Fatigue. Diabetes can make you feel tired and lacking in energy because your body isn't using glucose properly as an energy source. Blurred vision. Elevated blood sugar levels can affect how your eyes focus, leading to blurred vision. Slow healing wounds. Diabetes can impair your body's ability to heal, which can make wounds take longer to heal. Unexplained weight loss. If you have type 1 diabetes, you might lose weight unintentionally as your body isn't producing enough insulin to process the food you consume. If you experience any of these symptoms, it's important to consult a doctor for a diabetes test and an accurate diagnosis. Type 1 diabetes is an autoimmune disease in which the body destroys the pancreatic beta cells that produce insulin. This means the body can't produce insulin properly and requires daily insulin injections to survive. Symptoms of type 1 diabetes can appear suddenly and worsen rapidly. Some of the most common symptoms include excessive thirst and frequent urination, excessive hunger or loss of appetite, unexplained fatigue or weakness, unexplained weight loss, blurred vision, slow wound healing or frequent infections, irritability or mood changes, nausea and vomiting. It's important to treat type 1 diabetes immediately to prevent severe complications. If you experience any of these symptoms, seek medical attention promptly for an accurate diagnosis and appropriate treatment. There are several types of diabetes, but the three primary types are type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes, an autoimmune disease in which the body destroys insulin-producing beta cells in the pancreas. Symptoms include excessive thirst, frequent urination, fatigue, unexplained weight loss, blurred vision, slow wound healing, and irritability. Type 2 diabetes, a condition where the body doesn't produce enough insulin or use it properly. Symptoms include excessive thirst, frequent urination, fatigue, blurred vision, slow wound healing, and recurrent infections. Gestational diabetes occurs during pregnancy and can affect women who didn't have diabetes previously. Symptoms include excessive thirst, frequent urination, and fatigue. Other types of diabetes include secondary diabetes, caused by other diseases or medications, and type 3 diabetes mellitus, which refers to Alzheimer's disease as a form of brain diabetes. It's important to manage diabetes through a healthy lifestyle, including a balanced diet, regular exercise, and, in some cases, medication. Untreated diabetes symptoms can lead to severe complications such as heart disease, strokes, kidney problems, and vision loss. Stress. What is stress, and how to avoid it? Stress is a natural physical and emotional response to challenging or stressful situations in life. Stress can be positive, such as when it motivates us to accomplish something, but it can also be negative and lead to physical and mental health problems. To avoid stress, there are several things you can do. Identify the causes of stress. Learn to identify the situations or factors that are causing you stress. It could be work, family, money, or anything else. Once you know the causes, you can find ways to manage them. Learn relaxation techniques. Practice relaxation techniques such as meditation, deep breathing, yoga, or massage. These techniques can help reduce stress levels and improve your quality of life. Maintain a healthy lifestyle. Maintain a healthy lifestyle, including a balanced diet, regular exercise, and adequate rest, to help reduce stress levels. Set boundaries. Establish clear boundaries in your life, both at work and in your personal life. Learn to say no when necessary to avoid overwhelming yourself and becoming stressed. Seek social support. Seek support from friends and family during times of stress. Talking to someone can help alleviate anxiety and stress. Focus on positive thoughts. Try to focus on positive and realistic thoughts instead of worrying about things you cannot control. In general, it's essential to remember that stress is a natural part of life. However, if you feel overwhelmed or if stress affects your daily life, it's important to seek professional help. A therapist or counselor can assist in developing coping skills and effective stress management strategies. How can I relieve chronic illnesses caused by stress? Chronic illnesses caused by stress, such as anxiety, depression, high blood pressure, heart diseases, diabetes, and inflammatory bowel disease, can be treated with a combination of lifestyle changes and medical treatment. Here are some recommendations. Reduce stress. Practice relaxation techniques like meditation, deep breathing, yoga, or massage to reduce stress. Exercise regularly. Regular exercise can help reduce stress and improve overall health. Get enough sleep. Ensure you get enough sleep each night, as sleep deprivation can worsen the symptoms of chronic illnesses. Maintain a healthy diet. A healthy diet can help reduce the risk of chronic illnesses and improve overall health. Take medications. In severe cases, medications can help control the symptoms of chronic illnesses, such as anxiety, depression, and high blood pressure. Therapy. Therapy can be beneficial in treating stress-related chronic illnesses, such as anxiety and depression. It's essential to remember that the treatment for stress-related chronic illnesses should be personalized and tailored to each person's needs. It's always advisable to consult with a doctor to receive an accurate diagnosis and appropriate treatment. Nervous system. Diseases of the nervous system are disorders that affect the brain, spinal cord, and the body's nerves. These diseases can have various causes and present different symptoms. Some of the most common diseases of the nervous system include Alzheimer's disease, a degenerative disorder that affects memory and other cognitive functions. Parkinson's disease, a movement disorder that causes tremors, muscle rigidity, and balance problems. Multiple sclerosis, an autoimmune disease that affects the myelin-covering nerves, which can cause vision problems, muscle weakness, and other symptoms. Epilepsy, a disorder that causes seizures and other neurological symptoms. Migraines, recurrent headaches that may be accompanied by other symptoms such as sensitivity to light and sound. Amyotrophic lateral sclerosis, ALS, a neuromuscular disorder that affects muscle function and can lead to paralysis. Anxiety disorders, disorders that can affect how the brain processes information, leading to symptoms such as excessive anxiety, fear, and worry. The symptoms of nervous system diseases can vary widely depending on the type of disorder but may include changes in mood, memory and cognitive problems, balance and coordination issues, muscle weakness, tremors, seizures, headaches, and other neurological symptoms. It is essential to seek medical attention if a nervous system disease is suspected. Treatments may include medications, therapy, and other approaches depending on the type and severity of the disorder. How to prevent these diseases? Not all diseases of the nervous system can be prevented because many of them are caused by genetic or unknown factors. However, there are some things you can do to reduce the risk of some of these diseases or delay their onset. Maintain a healthy and balanced diet. A diet rich in fruits, vegetables, and healthy fats can help protect the brain and reduce the risk of diseases such as Alzheimer's. Stay physically active. Regular exercise can help keep the brain and body healthy, reduce the risk of nervous system diseases such as Parkinson's, and improve cognitive function. Manage stress. Chronic stress can affect brain health and increase the risk of diseases like depression and anxiety. Get enough sleep. Adequate sleep is essential for brain and overall health. Chronic sleep deprivation can increase the risk of nervous system diseases like Alzheimer's and Parkinson's. Protect the brain from injuries. Traumatic head injuries can increase the risk of diseases like Alzheimer's and Parkinson's. Taking measures to protect the brain, such as wearing helmets when cycling or engaging in contact sports, is important. It is important to remember that even if you follow these recommendations, there is no guarantee that you will avoid all nervous system diseases. If you notice any changes in cognitive function or neurological symptoms, it is crucial to seek immediate medical attention. Nerve diseases. There are several diseases that can affect the nerves, and each has its own set of symptoms. Here are some of the most common nerve diseases and their symptoms. Trigeminal neuralgia, a disorder that affects the trigeminal nerve and can cause intense pain in the face, especially in the jaw, cheeks, and eyes. Peripheral neuropathy, a disorder that affects peripheral nerves and can cause pain, tingling, numbness, and muscle weakness in the limbs. Multiple sclerosis, an autoimmune disease that affects the central nervous system and can cause muscle weakness, balance problems, blurred vision, numbness, and difficulty speaking and thinking clearly. Parkinson's disease, a neurodegenerative disease that affects the central nervous system and can cause tremors, muscle stiffness, slow movement, balance and coordination problems, and difficulty speaking and swallowing. Carpal tunnel syndrome, a disorder that affects the median nerve in the wrist and can cause pain, numbness, and tingling in the hand and fingers. It is important to seek medical attention if you experience symptoms related to nerves, as they may be indicative of an underlying disease. Early diagnosis and treatment can help prevent long-term complications. Mental illness and their symptoms. Mental illnesses, also known as mental disorders, are conditions that affect a person's mental and emotional health. These disorders can affect the way a person thinks, feels, and behaves. Some of the most common mental disorders include: depression, causes persistent feelings of sadness, hopelessness, and a lack of interest in everyday activities. Anxiety disorders, include intense feelings of worry or fear that do not subside over time. Post-traumatic stress disorder, PTSD, symptoms of anxiety and fear that occur after a traumatic event. Personality disorders, patterns of inflexible thinking, feeling, and behavior that cause problems in interpersonal relationships. Eating disorders, abnormal eating patterns that affect physical and mental health, such as anorexia and bulimia. Schizophrenia, a severe mental disorder that can cause delusions, hallucinations, and disordered thinking. Bipolar disorder, extreme mood swings, from depression to mania. The symptoms of mental disorders can vary widely depending on the type of disorder but may include changes in mood, changes in sleep or eating patterns, difficulty concentrating, social isolation, changes in energy levels, problems performing daily activities, and difficulties in interpersonal relationships. It is essential to seek professional help if you suspect you have a mental disorder. Treatments may include therapy, medication, and other approaches, depending on the type and severity of the disorder. Neurological diseases and their symptoms. Neurological diseases are disorders that affect the nervous system and can cause a variety of symptoms. Here are some of the most common neurological diseases and their symptoms. Multiple sclerosis, an autoimmune disease that results in the destruction of nerve tissue, leading to muscle weakness, numbness, vision problems, fatigue, and difficulty speaking and walking. Parkinson's disease, a neurodegenerative disease that affects movement, causing tremors, muscle stiffness, slow movement, balance and coordination problems, and difficulty speaking and swallowing. Alzheimer's disease, a neurodegenerative disease that leads to memory problems, changes in mood and behavior, confusion, and difficulty with daily tasks. Amyotrophic lateral sclerosis, ALS, a disease that causes the degeneration of nerve cells controlling muscles, resulting in muscle weakness, difficulty speaking, swallowing, and breathing. Huntington's disease, a neurodegenerative disease that affects movement and behavior, leading to involuntary movements, balance and coordination problems, depression, and personality changes. It is important to remember that if you experience any of these symptoms, seeking immediate medical attention is crucial. Additionally, maintaining a healthy lifestyle, including a balanced diet, regular exercise, avoiding excessive tobacco and alcohol use, and maintaining good mental health, is fundamental for preventing neurological diseases. The symptoms of a stroke, or cerebrovascular accident, may include sudden weakness or numbness in the face, arm, or leg, typically on one side of the body. Confusion, difficulty speaking, or understanding what is being said. Sudden vision problems in one or both eyes, such as blurred or double vision. Difficulty walking, sudden dizziness or loss of balance or coordination. Sudden and severe headache without an apparent cause. It's important to note that these symptoms can vary from person to person, and some may come and go within minutes. If you suspect someone is having a stroke, call emergency services immediately. Early treatment can make a significant difference in the patient's recovery. Inflammations. Inflammatory diseases are disorders that cause chronic inflammation in different parts of the body. Some of the most common inflammatory diseases and their symptoms include rheumatoid arthritis, an autoimmune disease that affects the joints, causing pain, inflammation, stiffness, and deformities. Inflammatory bowel disease, IBD, includes Crohn's disease and ulcerative colitis, which cause chronic inflammation in the gastrointestinal tract, leading to abdominal pain, diarrhea, weight loss, and fatigue. Asthma, a chronic inflammatory disease of the airways that results in difficulty breathing, coughing, wheezing, and chest tightness. Systemic lupus erythematosus, an autoimmune disease that affects various organs and tissues, causing fatigue, joint pain, fever, skin rashes, and kidney problems. Psoriasis, an autoimmune disease that causes inflammation in the skin, resulting in red, scaly patches that can be painful and itchy. Ankylosing spondylitis, a chronic inflammatory disease that affects the joints of the spine, causing back pain and stiffness. Arthritis is a disease characterized by inflammation of the body's joints. There are various types of arthritis, and each may have its own symptoms, although some general symptoms may include pain and tenderness in the joints. Stiffness in the joints, especially after prolonged periods of sitting or lying down. Reduced joint mobility. Swelling and warmth in the joints. Joint deformities. Generalized fatigue and weakness. It's important to remember that these inflammatory diseases are chronic and do not have a cure, but they can be treated and managed with medication and lifestyle changes. If you experience any of these symptoms, it's important to seek medical attention for an accurate diagnosis and appropriate treatment. Arthritis. There are several types of arthritis, some of which are described below. Rheumatoid arthritis. It is a chronic autoimmune disease in which the immune system attacks the lining of the joints, leading to pain, swelling, and stiffness. Rheumatoid arthritis can affect any joint, but it is more common in the hands, wrists, and feet. Osteoarthritis, also known as degenerative joint disease, it is the most common form of arthritis. It occurs when the cartilage that covers the joints wears down over time, resulting in pain, stiffness, and difficulty moving the joints. Osteoarthritis is more common in the hands, hips, knees, and spine. Psoriatic arthritis. It is an autoimmune disease that affects people with psoriasis, a skin condition. It can cause pain, swelling, and stiffness in the joints, as well as red, scaly patches on the skin. Juvenile idiopathic arthritis. This is a form of arthritis that affects children and young people under 16 years of age. It can lead to joint pain, swelling, and stiffness, as well as growth delays and bone deformities. Infectious arthritis occurs when a bacterial or viral infection spreads to a joint, resulting in pain, swelling, and fever. Infectious arthritis can affect any joint but is more common in the knee. Gouty arthritis, also known as gout, it is a form of arthritis that occurs when uric acid accumulates in the joints, causing pain, swelling, and redness. Gouty arthritis is more common in the big toe but can also affect other joints. It is important to note that each type of arthritis has its own symptoms and treatments, so it is important to consult a doctor if you experience joint pain or stiffness. Bones. Bone diseases and their symptoms. Bone diseases can affect people of all ages and genders. Here are some examples of bone diseases and their symptoms. Osteoporosis. Osteoporosis is a disease that weakens bones, making them more prone to fractures. Symptoms may include back pain, gradual loss of height, poor posture, and an increased risk of fractures. Arthritis. Arthritis is an inflammatory disease that affects the joints. Symptoms may include pain, stiffness, swelling, and difficulty moving the affected joints. Osteoarthritis. Osteoarthritis is a degenerative disease that affects the joints. Symptoms may include pain, stiffness, swelling, and difficulty moving the affected joints. Osteomyelitis. Osteomyelitis is a bone infection that can be caused by bacteria or other microorganisms. Symptoms may include pain, redness, swelling, and fever. Paget's disease. Paget's disease is a bone disease in which bones become larger and deformed. Symptoms may include bone pain, bone deformities, and fractures. Osteogenesis imperfecta. Osteogenesis imperfecta is a genetic disease that makes bones more fragile and prone to fractures. Symptoms may include deformed bones, dental problems, and hearing loss. Perta's disease. Perta's disease affects the head of the femur in the hip and can cause hip pain and stiffness. It is important to seek medical attention if you experience any of these symptoms to receive a proper diagnosis and treatment. Additionally, maintaining a healthy diet and regular exercise can help keep bones strong and prevent bone diseases. Muscles. Some common muscle diseases include muscle strain. Muscle strain is an injury to the muscles that occurs when they are stretched too far. Muscle tear. A muscle tear is an injury to the muscles that occurs when they are stretched beyond their capacity. Muscle cramps. Muscle cramps are painful and involuntary muscle contractions. Muscle spasms. Muscle spasms are involuntary and intense muscle contractions. Muscular dystrophy. Muscular dystrophy is a genetic disease that causes muscle weakness and atrophy. Fibromyalgia. Fibromyalgia is a chronic disease that causes widespread muscle pain and fatigue. Polymyositis. Polymyositis is an autoimmune disease that causes muscle weakness and pain. The symptoms of muscle diseases can vary depending on the type of disease, but some common symptoms include muscle pain, muscle weakness, muscle spasms, fatigue, cramps, and muscle stiffness. If you experience any of these symptoms, it's important to seek medical help. Skin. There are many skin diseases that can affect people, each with its own symptoms and characteristics. Some of the most common skin diseases and their symptoms include acne. Acne is a skin disease characterized by the presence of pimples or blackheads on the skin. These can be closed or open comedones, pimples, or cysts. Acne can be painful and cause inflammation of the skin. Eczema. Eczema is a skin disease characterized by dry skin, itching, and redness. The skin can crack, and crusts or blisters may form on the skin. Psoriasis. Psoriasis is a skin disease characterized by the appearance of red, scaly patches on the skin. The patches can be thick and cover large areas of the body, such as the elbows, knees, and scalp. Seborrheic dermatitis. Seborrheic dermatitis is a skin disease characterized by scaling and redness in oily areas of the skin, such as the scalp, eyebrows, and nose. Rosacea. Rosacea is a skin disease characterized by red and sensitive skin on the face. Small blood vessels may appear on the skin, and there may also be outbreaks of acne-like pimples. Urticaria. Urticaria is a skin disease characterized by the appearance of raised red welts on the skin. It can be caused by an allergic reaction to a substance or by stress. If you experience any of these symptoms, it's important to consult a doctor for an accurate diagnosis and proper treatment. How to avoid getting a skin disease. To prevent skin diseases, it's important to follow certain preventive measures. Some recommendations for preventing skin diseases are: keep the skin clean, regularly wash your skin to remove excess oil, dirt, and bacteria that can clog pores and cause skin problems. Moisturize the skin, use a moisturizer to keep the skin hydrated and healthy. This can help prevent dryness, peeling, and other skin issues. Protect the skin from the sun, use sunscreen and protective clothing if exposed to the sun for extended periods to avoid sunburn and reduce the risk of developing skin cancer. Avoid irritating products. Avoid using skincare products that contain irritating chemicals that can harm the skin. Maintain a healthy diet. A healthy diet can help keep the skin healthy and prevent skin problems. Reduce stress. Stress can affect the skin and worsen existing skin issues. Try to find ways to reduce stress in your life. Don't share personal items. Avoid sharing personal items such as towels, makeup, or clothing, as this can spread bacteria and viruses that can cause skin diseases. Following these recommendations can significantly reduce the risk of contracting skin diseases. It's always important to consult a doctor if you experience any skin disease symptoms for an accurate diagnosis and appropriate treatment. Skin spots is a sign to be alert. Skin spots can be caused by various reasons. Some of the most common include sun exposure. Prolonged sun exposure can lead to dark spots on the skin, especially on areas like the face, hands, and arms. Aging. As we age, the skin can develop dark spots due to the accumulation of cellular damage over time. Hormonal changes. Hormonal changes during pregnancy or menopause can cause dark spots on the skin, such as melasma. Allergies. Some allergies to cosmetics or cleaning products can lead to skin spots. Skin diseases. Skin conditions like atopic dermatitis, psoriasis, and vitiligo can lead to skin spots. Infections. Certain infections, such as human papillomavirus, HPV, or candidiasis, can cause skin spots. It's important to remember that not all skin spots are indicative of a health condition. However, if the spots are new, changing in size, shape, or color, or accompanied by other symptoms like itching or pain, medical attention should be sought to determine the cause and receive appropriate treatment. The main causes of skin diseases can vary depending on the type of condition presented. However, in general, some of the factors that may contribute to the development of skin diseases include hyperpigmentation. This occurs when the skin produces too much melanin, resulting in dark spots on the skin. Hyperpigmentation can be caused by sun exposure, hormonal changes, genetic inheritance, skin injuries, or reactions to medications. Vitiligo. This is an autoimmune condition in which the immune system attacks and destroys the cells that produce pigment in the skin. This results in white patches on the skin, which may be more noticeable in people with darker skin. Pityriasis versicolor. This is a common fungal infection that causes scaly patches on the skin, which can be white, brown, or pink. This condition is most commonly seen in people living in warm and humid climates. Seborrheic dermatitis. This is a skin condition that causes greasy and scaly patches on the scalp, face, and other parts of the body. Seborrheic dermatitis can be caused by various factors, such as excessive oil production on the skin, yeast on the skin, or stress. Psoriasis. This is an autoimmune disease that causes red and scaly patches on the skin. Psoriasis can be hereditary and can worsen with stress and certain medications. Hormonal changes. Hormonal changes can lead to skin issues such as acne and dark spots on the skin. Genetics. Some skin diseases can be hereditary, such as atopic dermatitis and psoriasis. Skin injuries. Skin injuries like cuts, scrapes, and burns can increase the risk of infection and scarring. Autoimmune diseases. Certain autoimmune diseases can affect the skin, such as lupus and dermatomyositis. Stress. Stress can exacerbate certain skin diseases like seborrheic dermatitis and acne. Infections, fungal, bacterial, and viral infections can cause various skin problems, including athlete's foot, acne, and herpes. Eyes. Eye diseases can affect a person's vision, and in some cases, they can lead to blindness if not properly treated. Here are some common eye diseases and their symptoms. Cataracts. Cataracts occur when the eye's lens becomes cloudy, which can lead to blurred vision, light sensitivity, and difficulty seeing at night. Glaucoma. Glaucoma is a disease that damages the optic nerve and can result in vision loss. Symptoms include headaches, blurred vision, eye pain, and tunnel vision. Age-related macular degeneration, AMD. AMD is an eye disease that causes loss of central vision, making it difficult to perform everyday tasks like reading or driving. Symptoms include blurred vision and difficulty seeing small objects or fine details. Conjunctivitis. Conjunctivitis is an inflammation of the conjunctiva, the membrane that covers the surface of the eye and the inside of the eyelids. Symptoms include redness, itching, burning sensation, tearing, and discharge. Dry eye. Dry eye syndrome occurs when the eyes don't produce enough tears, or the tears are of inadequate quality to keep the eyes lubricated. Symptoms include burning, itching, redness, and blurred vision. It's important to remember that if you experience any of these symptoms, seeking medical attention is important to receive an accurate diagnosis and proper treatment. Additionally, taking care of our eyes through good hygiene and protecting them from sunlight and exposure to irritating substances is crucial. Ears. The color of earwax can vary from pale yellow to dark brown. However, there is no specific color that indicates a specific health condition. Earwax can be yellow or brown due to the buildup of dead skin cells, dust, and dirt in the ear canal. The color can also be influenced by the amount of melanin in the skin of the ear canal. However, if earwax is green or black in color, it may be indicative of an ear infection. If the wax is red or bloody, there may be an injury to the ear canal or eardrum. In summary, the color of earwax can vary, and there is no specific color that indicates a medical condition. If you have any concerns about the color or amount of wax in your ear, it is advisable to consult a healthcare professional. While not all earwax colors necessarily indicate a medical condition or disease, here is a list of the most common earwax colors and what they may indicate. Light yellow or light brown earwax. This is the most common earwax color and generally does not indicate a medical condition. Dark brown earwax. This color of earwax can be caused by the buildup of dead skin cells or the use of hearing aids and headphones. It is typically not a cause for concern. White or grayish earwax. This type of wax may indicate a medical condition called otitis externa, an inflammation of the ear canal's skin. It can also be caused by the use of ear drops. Green or dark yellow earwax. This color may indicate an ear infection. If you experience ear pain, fever, or other symptoms, it's important to seek medical attention. Red or bloody earwax. This can indicate an injury to the ear canal or eardrum, and immediate medical attention is important. It's important to note that the color of earwax can be influenced by various factors, including age, diet, and personal hygiene. If you have concerns about your earwax, it's best to consult a healthcare professional for proper evaluation and guidance. Mouth. Some common dental diseases and their symptoms include dental caries. Tooth decay. Dental caries is a disease that destroys tooth enamel and can cause tooth pain, sensitivity to heat and cold, and cavities. Gingivitis. Gingivitis is a gum disease that causes inflammation, redness, and bleeding of the gums. Periodontitis. Periodontitis is a gum disease that damages the tissues supporting the teeth, potentially leading to tooth loss. Dental abscess. A dental abscess is an infection in the tooth or gums that can cause tooth pain, swelling, and fever. Advanced periodontal disease. Advanced periodontal disease is a gum disease that can result in bone and tooth loss. Malocclusion. Malocclusion is a dental misalignment problem that can cause jaw pain and difficulty biting and chewing. It's important to visit the dentist regularly to prevent and treat dental diseases. Symptoms can vary depending on the type of dental disease, but common symptoms include tooth pain, gum inflammation and bleeding, dental sensitivity, bad breath, and difficulty biting and chewing. If you experience any of these symptoms, it's important to seek dental care as soon as possible. Bad breath. Bad breath, also known as halitosis, can be caused by various factors, including dental issues. Common causes of bad breath include cavities, dental plaque, and gum diseases. Bacteria in the mouth can produce foul-smelling compounds. Dietary habits. Some foods like garlic, onions, and coffee can lead to bad breath. Additionally, skipping meals or following a low-carb diet can cause halitosis. Respiratory conditions. respiratory infections such as bronchitis and pneumonia can result in bad breath. Nasal congestion can also contribute to the problem. Gastrointestinal problems, gastrointestinal issues like gastroesophageal reflux disease, GERD, and dyspepsia can cause halitosis as gases are released from the stomach into the mouth. Tobacco and alcohol, smoking and alcohol consumption can lead to bad breath by drying out the mouth and promoting bacterial growth. Medications, some medications, such as antidepressants and diuretics, can reduce saliva production and cause a dry mouth, which can lead to bad breath. It's essential to maintain good oral hygiene, including brushing your teeth twice a day and using dental floss, to prevent bad breath. It's also advisable to avoid tobacco and alcohol and drink plenty of water to stay hydrated. If bad breath persists despite lifestyle changes, seeking medical attention to identify the underlying cause and receiving treatment is recommended. Causes of snoring. Snoring is a common issue that affects both men and women and can be a source of discomfort for those who sleep near the person who snores. Snoring is caused by an obstruction in the upper airways, hindering the flow of air and causing vibrations in the soft tissues of the throat. Here are some of the most common causes of snoring. Overweight or obesity. Excess weight can put pressure on the airways, increasing the likelihood of snoring. Alcohol and tobacco use. Alcohol and tobacco can relax the throat muscles, leading to airway obstruction and an increased risk of snoring. Advanced age. As we age, the throat muscles lose tone and elasticity, potentially causing airway obstruction and snoring. Head and neck anatomy. Some individuals may have a facial or neck structure that makes them more prone to snoring, such as a long soft palate or a small jaw. Respiratory illnesses, nasal congestion, sinusitis, or any other condition affecting the upper airways can lead to snoring. Sleep position. Sleeping on the back can cause the tongue and soft tissues in the throat to fall backward and obstruct the airway, resulting in snoring. Medications. Some medications may relax throat muscles, increasing the risk of snoring. If snoring is a recurrent issue, it's essential to seek medical attention to rule out any underlying disorders. Treatments can range from lifestyle changes, such as weight loss and avoiding alcohol and tobacco, to medical devices that help keep the airways open during sleep. In severe cases, surgery may be considered to correct any structural abnormalities in the throat. Circulatory system. Diseases of the circulatory system encompass various conditions that affect the heart, blood vessels, and blood circulation in the body. Some of the most common circulatory system diseases and their symptoms include coronary artery disease. Coronary artery disease is a condition in which the arteries that supply blood to the heart narrow and can cause chest pain, shortness of breath, and fatigue. Heart failure. Heart failure is a condition in which the heart cannot pump enough blood to the body, which can lead to fatigue, leg swelling, and shortness of breath. Hypertension. High blood pressure. Hypertension is a condition in which blood pressure is too high and can lead to headaches, dizziness, blurred vision, and, in severe cases, strokes and heart attacks. Aneurysm. An aneurysm is an abnormal dilation of an artery that can rupture and cause internal bleeding, leading to intense chest and back pain. Thrombosis. Thrombosis is the formation of blood clots in blood vessels, which can block blood flow and cause pain, swelling, and redness in the affected area. Arteriosclerosis. Arteriosclerosis is a condition in which arteries become stiff and narrow, making blood flow difficult and causing chest pain and discomfort in the extremities. It is important to seek medical attention if you experience symptoms related to the circulatory system. Some common symptoms include chest pain, fatigue, shortness of breath, dizziness, and palpitations. Changes in diet, regular exercise, and medications can help prevent and treat many circulatory system diseases. Leukemia. Leukemia is a cancer that affects white blood cells. Leukemia symptoms can vary depending on the type of leukemia and the stage of the disease, but some of the most common symptoms include fatigue. Leukemia can make you feel tired and lacking in energy, even if you have rested enough. Fever and night sweats. Leukemia can cause fever and night sweats, especially during the nighttime. Frequent infections. As leukemia affects the immune system, you may be more prone to frequent infections. Unexplained weight loss. You can lose weight unintentionally if you have leukemia, as the disease can affect your appetite and the body's ability to process food. Bone or joint pain. Leukemia can cause pain in the bones or joints, especially in large bones like the pelvis or sternum. Bleeding or bruising easily. Leukemia can affect platelet production, leading to easy bleeding or bruising. If you experience any of these symptoms, it is important to consult a doctor for an accurate diagnosis. Heart. Heart diseases are disorders that affect the structure and function of the heart and blood vessels. Here are some of the most common heart diseases and their symptoms. Coronary artery disease occurs when the arteries that supply blood to the heart narrow or become blocked, leading to chest pain, chest tightness, shortness of breath, and sweating. Heart failure occurs when the heart cannot pump enough blood to meet the body's needs, resulting in fatigue, shortness of breath, swelling in the legs and feet, and sudden weight gain. Heart arrhythmias are changes in heart rhythm that can cause palpitations, dizziness, fainting, fatigue, and chest pain. Congenital heart disease is a heart disease present at birth that can cause cyanosis, fatigue, shortness of breath, and slow growth. Heart valve disease occurs when one or more heart valves do not function properly, leading to fatigue, shortness of breath, swelling in the ankles and feet, and chest pain. It is important to remember that if you experience any of these symptoms, seeking immediate medical attention is essential. It is also crucial to adopt a healthy lifestyle to prevent heart disease, which includes maintaining a healthy diet, regular exercise, not smoking, and monitoring blood pressure and cholesterol. The symptoms of a heart attack may include chest pain or discomfort, which can feel like pressure, tightness, burning, or sharp pain. Pain or discomfort in one or both arms, back, neck, jaw, or stomach. Shortness of breath or difficulty breathing. Cold sweats, nausea, or dizziness. Fatigue, weakness, or sudden fainting. It is important to note that symptoms can vary in each person, and some individuals may experience a heart attack without any symptoms. If you suspect someone is having a heart attack, call emergency services immediately. Lungs. Lung diseases are disorders that affect the lungs and can cause difficulty breathing, coughing, and other symptoms. Here are some common lung diseases and their symptoms. Asthma, a chronic disease that causes inflammation and narrowing of the airways, leading to cough, wheezing, chest tightness, and difficulty breathing. Chronic obstructive pulmonary disease, COPD, a chronic lung disease that causes difficulty breathing, chronic cough, and sputum production. It can also lead to fatigue, swelling in the legs and feet, and weight gain. Pulmonary fibrosis, a disease that causes scarring in the lungs and difficulty breathing. Other symptoms include fatigue, weight loss, and chest pain. Pneumonia, an inflammation of lung tissue that can cause cough, fever, chills, chest pain, and difficulty breathing. Tobacco-related lung diseases. Smoking can lead to lung diseases such as lung cancer, COPD, and chronic bronchitis. It is important to remember that if you experience any of these symptoms, seeking immediate medical attention is essential. It is also crucial to adopt a healthy lifestyle to prevent lung diseases, which includes not smoking, avoiding exposure to smoke and polluted air, regular exercise, and maintaining a healthy diet. Colon. Intestinal diseases can affect both the small and large intestines and can have a variety of symptoms depending on the specific cause of the disease. Some of the most common intestinal diseases and their symptoms include Crohn's disease. This is a chronic inflammatory disease of the intestine that can affect any part of the gastrointestinal tract. Common symptoms include abdominal pain, diarrhea, fever, weight loss, and fatigue. Ulcerative colitis. This is another chronic inflammatory disease of the intestine that primarily affects the colon and rectum. Symptoms include abdominal pain, bloody diarrhea, urgency to defecate, and fatigue. Irritable bowel syndrome. IBS. This is a chronic intestinal condition characterized by abdominal pain, bloating, and changes in bowel habits. Symptoms may also include constipation and diarrhea. Celiac disease. It is an autoimmune disease in which the body reacts to gluten, a protein found in wheat, barley, and rye. Symptoms include abdominal pain, diarrhea, bloating, and weight loss. Diverticulitis. This is inflammation of the diverticula, pouches that form in the colon wall, that can cause abdominal pain, nausea, and fever. It is important to consult a doctor if you experience persistent or concerning symptoms in the intestine, as they may be indicative of a more serious condition. Intestinal transit. Intestinal transit, also known as bowel transit, refers to the movement of food through the digestive tract for processing and elimination. When there are complications in this process, a range of symptoms and conditions can arise. Here are some of the most common complications of intestinal transit and their associated symptoms. Constipation. Constipation occurs when feces become hard and dry, making it difficult to pass through the intestinal tract. Symptoms include difficulty with bowel movements, abdominal pain, bloating, and abdominal distension. Diarrhea. Diarrhea occurs when feces become softer and looser than usual, leading to frequent and urgent bowel movements. Symptoms include loose or watery stools, abdominal pain, cramps, nausea, and vomiting. Irritable bowel syndrome, IBS. IBS is a chronic condition of the intestinal tract characterized by abdominal pain, changes in bowel movement patterns, and other symptoms such as bloating and gas. Symptoms can be intermittent and are often triggered by stress or diet. Inflammatory bowel disease, IBD. IBD is a chronic condition that causes inflammation in the intestinal tract and is subdivided into two main categories, Crohn's disease and ulcerative colitis. Symptoms include abdominal pain, diarrhea, rectal bleeding, fatigue, and weight loss. Intestinal obstruction. Intestinal obstruction occurs when food cannot pass completely through the intestinal tract due to a blockage. Symptoms include abdominal pain, nausea, vomiting, and abdominal distension. Diverticulitis. Diverticulitis occurs when small pouches in the colon wall become inflamed or infected. Symptoms include abdominal pain, fever, nausea, vomiting, and changes in bowel habits. It is important to seek medical attention if you experience persistent or severe symptoms associated with intestinal transit. Early diagnosis and appropriate treatment can prevent serious complications and improve the quality of life. Stomach. Several diseases can affect the stomach, and each has its own symptoms. Here are some of the most common stomach diseases and their symptoms. Gastritis. Gastritis is an inflammation of the gastric mucosa and can cause upper abdominal pain, nausea, vomiting, indigestion, a feeling of fullness, abdominal bloating, and loss of appetite. Gastric ulcers. Gastric ulcers are sores in the stomach's mucosa and can cause abdominal pain, nausea, vomiting, weight loss, loss of appetite, a feeling of fullness, and gastrointestinal bleeding. Gastroesophageal reflux. Gastroesophageal reflux is a disorder in which stomach acids flow back into the esophagus and can cause heartburn, throat pain, coughing, a bitter taste in the mouth, chest pain, and difficulty swallowing. Gastric cancer. Gastric cancer is a malignant tumor in the stomach and can cause abdominal pain, nausea, vomiting, weight loss, loss of appetite, anemia, and gastrointestinal bleeding. Irritable bowel syndrome. Irritable bowel syndrome, IBS, is a chronic digestive system disorder and can cause abdominal pain, diarrhea, constipation, abdominal bloating, gas, and a feeling of fullness. Celiac disease, an autoimmune reaction to gluten that can cause diarrhea, abdominal pain, weight loss, and fatigue. Pancreatitis, inflammation of the pancreas that can cause severe abdominal pain, nausea, and vomiting. It's important to seek medical attention if you experience symptoms related to the stomach, as they may be indicative of an underlying condition. Gastritis. Gastritis is an inflammation of the gastric mucosa, the lining of the stomach. The most common symptoms include upper abdominal pain or burning, this is one of the most common symptoms of gastritis. The pain can be mild or severe and may last for several minutes or hours. Nausea and vomiting. Gastritis can lead to nausea and vomiting, especially after eating. Loss of appetite. Inflammation of the gastric mucosa can reduce your appetite, resulting in weight loss. Feeling of fullness. After eating, some people may experience a sensation of fullness even if they haven't eaten much. Abdominal bloating. Gastritis can also cause abdominal bloating, making clothes feel tight. Indigestion. Indigestion is another common symptom of gastritis. People may experience heartburn, burping, and flatulence. Headaches and dizziness. Some individuals may experience headaches and dizziness due to stomach inflammation. It's important to seek medical attention if you experience symptoms of gastritis, as this condition can be serious if not treated properly. Gases. Uncontrollable gas, also known as flatulence, is a common condition that can be caused by various factors, including diet. Consuming high-fiber foods such as beans, peas, fruits, and vegetables can lead to flatulence. Additionally, foods high in fats and carbohydrates can produce gas. Food intolerances. Individuals who are intolerant to lactose, gluten, or other foods may experience flatulence after consuming these items. Inadequate chewing. Not chewing food properly can lead to increased gas production in the intestines. Consumption of carbonated beverages. Carbonated drinks can introduce air into the gastrointestinal tract and increase gas production. Intestinal diseases. Inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, can cause flatulence along with other gastrointestinal symptoms. Constipation. When a person is constipated, gas may become trapped in the intestines and cause flatulence. It's important to note that flatulence is a natural condition and generally does not require medical treatment unless it is excessive or accompanied by other symptoms. However, to prevent or reduce flatulence, it's advisable to eat slowly, chew food thoroughly, avoid foods known to cause gas, and engage in regular physical activity to maintain a healthy intestine. If flatulence persists despite lifestyle changes, it's recommended to seek medical attention to rule out underlying gastrointestinal conditions. Fecal odor. Foul-smelling feces can be caused by various factors, including diet. A diet high in fats, proteins, or foods with a high sulfur content, such as garlic and onions, can produce an unpleasant odor in feces. Gastrointestinal infections. Intestinal infections, such as gastroenteritis or infectious colitis, can lead to foul-smelling feces. Food intolerances. Intolerance to certain foods, such as lactose or gluten, can cause foul-smelling stools. Gastrointestinal disorders. Gastrointestinal disorders, such as inflammatory bowel disease or irritable bowel syndrome, can result in foul-smelling feces along with other gastrointestinal symptoms. Medication use. Some medications can produce a foul odor in feces as a side effect. Liver diseases, such as cirrhosis or hepatitis, may lead to foul-smelling stools. It's important to mention that at times, the odor of feces can be an indicator of an underlying health issue. If foul-smelling stools persist or are accompanied by other symptoms, it's advisable to seek medical attention to rule out potential gastrointestinal or liver conditions. Liver. Fatty liver, also known as hepatic steatosis, is a condition in which there is an excessive accumulation of fat in the liver cells. Some of the symptoms of fatty liver may include fatigue or a feeling of weakness, pain or a sensation of fullness in the liver area, loss of appetite, nausea and vomiting, unexplained weight loss, abdominal pain, abdominal bloating. In some cases, fatty liver may not present symptoms, so it is important to undergo regular screenings if you are considered to be at higher risk of developing this condition. Fatty liver can be caused by various factors, including obesity, diabetes, excessive alcohol consumption, and certain medications. Treatment for fatty liver may involve lifestyle changes such as weight loss, adopting a healthy diet, and regular exercise. In more severe cases, medications and/or procedures may be necessary to treat the underlying condition. Liver cirrhosis. Liver cirrhosis is a chronic condition in which the liver is damaged and replaced by scar tissue. In the early stages, there may be no symptoms, but as the disease progresses, the following symptoms may appear. Fatigue or weakness. Loss of appetite and weight loss. Nausea and vomiting. Abdominal swelling in the abdomen, legs, or ankles. Itching of the skin. Changes in the color of urine and stool. Appearance of small red veins on the skin. Confusion, difficulty concentrating, and mood changes. It is important to seek medical attention if you experience any of these symptoms, as liver cirrhosis can be a serious condition that can lead to potentially life-threatening complications, such as liver failure or liver cancer. Treatment for liver cirrhosis may involve lifestyle changes, such as avoiding alcohol and maintaining a healthy diet, as well as medications to control symptoms and prevent complications. In severe cases, a liver transplant may be necessary. Kidneys. Kidney diseases can manifest in various ways and with different symptoms, some of the most common being kidney insufficiency, characterized by a decrease in the kidney's ability to filter and eliminate waste from the body. Symptoms include fatigue, weakness, loss of appetite, nausea, vomiting, leg swelling, itchy skin, increased need to urinate, especially at night, and decreased urine production. Kidney stones. Kidney stones can cause intense pain in the side or lower back, as well as nausea and vomiting. Urine may be pink or brown due to the presence of blood. Urinary tract infections. Urinary tract infections, UTIs, occur when bacteria enter the urinary tract and multiply. Symptoms include pain or burning during urination, frequent urgent need to urinate, pain in the lower abdomen or back, and sometimes fever. Glomerulonephritis. It is an inflammation of the glomeruli, the small blood vessels in the kidneys that filter blood. Symptoms include swelling in the legs, feet, and face, foamy urine, increased blood pressure, and decreased urine output. Polycystic kidney disease. It is a hereditary condition in which cysts form in the kidneys, which can cause abdominal pain, side or back pain, blood in the urine, increased blood pressure, and decreased urine output. It is important to see a doctor if you experience these symptoms or any other related to the kidneys, as an early diagnosis can help prevent serious complications. Urination. The uncontrollable urge to urinate can be caused by different health conditions, some of which may be temporary and others more chronic. Some common causes include urinary tract infection. Urinary tract infection, UTI, is a common cause of frequent urination. In addition to the uncontrollable urge to urinate, UTIs can also cause pain or burning during urination, pain in the lower abdomen or lower back, and cloudy or bloody urine. Diabetes. Diabetes can increase the need for frequent urination because high blood sugar levels can affect the kidney's ability to absorb water. This can lead to increased urination and an uncontrollable need to urinate. Excessive fluid intake. Drinking large amounts of fluids can lead to frequent urination. This is especially common when consuming alcohol or caffeinated beverages. Prostate issues. In men, inflammation or enlargement of the prostate can cause urinary problems, including a frequent urge to urinate, an inability to completely empty the bladder, and difficulty starting urination. Hormonal changes. Hormonal changes during pregnancy can increase the need for frequent urination due to pressure from the uterus on the bladder. Bladder disease. Interstitial cystitis is a chronic bladder condition that can cause pelvic pain and a frequent need to urinate. It is important to seek medical attention if you experience an uncontrollable urge to urinate, especially if it is accompanied by pain, burning, or blood in the urine. A healthcare professional can determine the underlying cause and recommend appropriate treatment. Incontinence. Incontinence is the inability to control the bladder or bowels. Symptoms of incontinence can vary depending on the cause and severity of the condition, but in general, they may include involuntary loss of urine or feces, sudden and intense urge to urinate, frequent urination, Difficulty initiating the urine stream. Dribbling of urine after using the toilet. Difficulty completely emptying the bladder. Pain or burning during urination. It is important to consult a doctor if you experience these symptoms to determine the underlying cause and receive appropriate treatment. Dialysis. Dialysis is a medical procedure used to filter waste and excess fluids from the blood when the kidneys can no longer do so naturally. Dialysis may be necessary for people with chronic kidney disease or acute kidney failure. There are two main types of dialysis, hemodialysis and peritoneal dialysis. In hemodialysis, a machine is used to filter blood outside the body, pass it through a filter, and then return it to the body. In peritoneal dialysis, a special solution is used to filter blood within the abdomen. Dialysis is an important procedure that can help people with kidney problems lead longer and healthier lives. However, it can also be a challenging and time-consuming process. Therefore, it is important that people who require dialysis receive the necessary support and care to effectively manage this treatment. Scalp. Dandruff on the scalp is a common scalp disorder that can be caused by various factors. Some of the most common causes of scalp dandruff include seborrheic dermatitis. This is a common condition that leads to white and yellowish flakes on the scalp and is often caused by skin inflammation and excessive sebum production. Scalp fungi. Certain fungi, such as Malassezia, can cause scalp dandruff as they stimulate the production of dead skin cells. Dry skin. Dry skin can be one of the causes of dandruff on the scalp, as it can make the skin shed more easily. Sensitivity to hair products. Some hair products, such as shampoos, can irritate the scalp and lead to dandruff. Stress and fatigue. Stress and fatigue can increase sebum production and lead to the development of dandruff. Hormonal changes. Hormonal changes, such as those that occur during puberty or pregnancy, can increase sebum production and cause dandruff. It is important to treat dandruff to prevent it from worsening and causing complications such as scalp infections. If you experience persistent dandruff, it is recommended to see a dermatologist for an accurate diagnosis and appropriate treatment. Baldness. Baldness, also known as alopecia, can be a sign of various medical conditions. In men, the most common cause of baldness is androgenetic alopecia, which is a genetic condition related to the male hormone testosterone. This condition leads to thinning and hair loss on the crown and top of the head. Other causes of baldness include alopecia areata. It is an autoimmune disease in which the immune system attacks hair follicles, resulting in patches of baldness on the scalp or other parts of the body. Trichotillomania. It is an impulse control disorder in which people compulsively pull out their hair, leading to patches of baldness. Fungal scalp infections. These infections can cause itching, inflammation, and hair loss. Thyroid disorders. Thyroid disorders, such as hypothyroidism and hyperthyroidism, can cause hair loss. Medication side effects. Some medications, like chemotherapy, can cause temporary hair loss. Genetic factors. Male and female pattern baldness is hereditary and can be caused by a genetic predisposition. Hormonal changes. Hormonal changes can lead to hair loss, as seen in pregnancy, menopause, and thyroid conditions. Stress. Physical and emotional stress can trigger hair loss. Diseases and medications. Certain diseases like lupus and diabetes, as well as specific medications like chemotherapy, can lead to hair loss. Nutritional deficiencies. Lack of essential nutrients such as proteins, iron, and vitamin D can cause hair loss. Autoimmune disorders. Autoimmune disorders like alopecia areata can result in hair loss. Styling techniques and chemicals. Overuse of hair chemicals and heat styling can weaken and damage hair, causing hair loss. It is essential to consult a doctor if you experience significant hair loss or notice a pattern of baldness on the scalp, as it may be indicative of an underlying medical condition that requires treatment. Testosterone. Testosterone deficiency, also known as male hypogonadism, is a condition in which the testes do not produce a sufficient amount of testosterone. Some of the symptoms of testosterone deficiency may include Decreased sexual desire or libido. Erectile dysfunction or difficulty in maintaining an erection. Loss of muscle mass and strength. Fatigue or lack of energy. Decreased bone density or osteoporosis. Changes in the distribution of body hair. Changes in mood, such as depression or irritability. Decreased fertility. Treatment for testosterone deficiency may include testosterone replacement therapy and lifestyle changes, such as regular exercise and maintaining a healthy diet. Ovaries. Different diseases can affect the ovaries and cause various symptoms. Some ovarian diseases and their most common symptoms include ovarian cysts. These are fluid-filled sacs that form inside or on the ovaries. Symptoms may include abdominal or pelvic pain, bloating, changes in menstrual periods, and pain during sexual intercourse. Polycystic ovary syndrome, PCOS. This is a common hormonal disorder that affects women of reproductive age. Symptoms may include irregular or absent menstrual periods, acne, weight gain, and unwanted hair growth in specific areas. Endometriosis. This is a condition in which tissue normally lines the inside of the uterus grows outside of it, in other parts of the body. Symptoms may include severe pelvic pain during menstrual periods, pain during sexual intercourse, and difficulty getting pregnant. Ovarian tumors. Ovarian tumors can be benign or malignant and can cause different symptoms depending on their size and location. Symptoms may include abdominal or pelvic pain, abdominal swelling, changes in menstrual periods, and pain during sexual intercourse. It is important to consult a doctor if you experience persistent or concerning symptoms related to the ovaries. Early diagnosis and treatment can help prevent complications and improve the quality of life. Cancer. Cancer is a disease in which the body's cells grow and divide uncontrollably, forming tumors that can be benign or malignant. Malignant tumors, also known as cancer, can invade nearby tissues and organs, as well as spread to other parts of the body through the bloodstream or lymphatic system. While there are many types of cancer, some of the most common ones include skin cancer, breast cancer, lung cancer, colorectal cancer, prostate cancer, cervical cancer, and ovarian cancer. Symptoms for each type of cancer can vary widely but generally include changes in the shape or size of an organ or body part, pain, fatigue, weight loss, changes in bowel habits, persistent cough, abnormal bleeding, and other symptoms. Early diagnosis of cancer is essential for successful treatment and better prognosis. It's important for individuals to undergo regular medical checkups and early screening tests, such as mammograms, colonoscopies, and pap smears, as recommended by their healthcare provider. Additionally, maintaining a healthy lifestyle, avoiding tobacco, and limiting alcohol consumption can help reduce the risk of developing cancer. There are many different types of cancer, and symptoms vary depending on the type and stage of the disease. Below are some of the most common types of cancer and their symptoms. Skin cancer, a lump or spot on the skin that changes in size, shape, or color. Breast cancer, a lump in the breast or under the arm, changes in breast size or shape, nipple discharge, or orange peel skin. Lung cancer, persistent cough, chest pain, difficulty breathing, coughing up blood, or hoarseness. Colorectal cancer, changes in bowel habits, abdominal pain, rectal bleeding, blood or mucus in stools. Prostate cancer, urinary problems, pain or burning during urination, pelvic or lower back pain. Cervical cancer, abnormal vaginal bleeding, pain during sexual intercourse, foul-smelling vaginal discharge, or pelvic pain. Ovarian cancer, abdominal pain or swelling, changes in bowel habits, feeling full quickly after eating a small amount. It's important to remember that these are just some of the most common types of cancer, and symptoms can vary widely depending on the type of cancer and the stage of the disease. If you experience any concerning symptoms, it's important to seek medical attention immediately. Additionally, maintaining a healthy lifestyle, undergoing regular medical checkups, and participating in early screening tests can help prevent cancer or detect it at an early stage, increasing the chances of recovery. Adverse effects of medications. Medications are a fundamental tool in the fight against many diseases and ailments. However, not all medications are safe and effective for everyone, and some of them can have side effects and adverse effects that can be severe and even jeopardize the health of patients. I recommend always reading the indications and contraindications as they are provided. That does not mean that we will experience all the side effects because we are not all the same, and we respond differently to medications. Still, it is good to take necessary precautions and discontinue the medication as soon as we experience any adverse reaction. Do not rely solely on what your doctor or specialist says because they are only trained to identify diseases and prescribe medication. In this chapter, we will discuss some of the most common side effects and adverse effects of medications prescribed for various conditions such as high blood pressure, cholesterol, inflammation, chronic pain, diabetes, gastritis, nerves, anxiety, and depression. Side effects of high blood pressure medications. Medications used to treat high blood pressure can have side effects that include fatigue, dizziness, headache, weight gain, sexual impotence, dry cough, and digestive problems. Some medications can also increase the risk of developing type 2 diabetes, kidney disease, and sleep disorders. It is essential for patients to inform their doctor if they experience any of these side effects and to follow the doctor's instructions regarding dosage and medication use. Side effects of cholesterol medications. Medications to lower cholesterol can have side effects that include muscle pain, weakness, abdominal pain, nausea, diarrhea, headache, dizziness, and weight gain. In some cases, these medications can also increase the risk of developing type 2 diabetes and liver disorders. It is important for patients to inform their doctor if they experience any of these side effects and to follow the doctor's instructions regarding dosage and medication use. Side effects of anti-inflammatory medications. Anti-inflammatory medications can have side effects that include abdominal pain, nausea, diarrhea, headache, dizziness, drowsiness, and increased blood pressure. In some cases, these medications can also increase the risk of developing gastrointestinal disorders, kidney disease, and liver disorders. It is important for patients to inform their doctor if they experience any of these side effects and to follow the doctor's instructions regarding dosage and medication use. Side effects of chronic pain medications. Medications used to treat chronic pain can have side effects that include drowsiness, dizziness, nausea, constipation, respiratory depression, increased pain sensitivity, and addiction. Some of these medications can also increase the risk of developing gastrointestinal disorders, kidney disease, and liver disorders. It is important for patients to inform their doctor if they experience any of these side effects and to follow the doctor's instructions regarding dosage and medication use. Side effects of diabetes medications. Medications used to treat diabetes can have side effects that include hypoglycemia, low blood sugar, nausea, diarrhea, abdominal pain, weight gain, and edema, fluid retention. In some cases, these medications can also increase the risk of developing heart disease and liver disorders. It is important for patients to inform their doctor if they experience any of these side effects and to follow the doctor's instructions regarding dosage and medication use. Side effects of gastritis medications. Medications used to treat gastritis can have side effects that include nausea, vomiting, diarrhea, abdominal pain, headache, dizziness, and increased sensitivity to sunlight. Some of these medications can also increase the risk of developing gastrointestinal disorders and allergic reactions. It is important for patients to inform their doctor if they experience any of these side effects and to follow the doctor's instructions regarding dosage and medication use. Side effects of nerve and anxiety medications. Medications used to treat anxiety in nerve disorders can have side effects that include drowsiness, dizziness, weakness, nausea, headache, decreased libido, and weight gain. In some cases, these medications can also increase the risk of developing sleep disorders and dependency. It is important for patients to inform their doctor if they experience any of these side effects and to follow the doctor's instructions regarding dosage and medication use. Side effects of depression medications. Medications used to treat depression can have side effects that include drowsiness, dizziness, nausea, dry mouth, constipation, weight gain, excessive sweating, and sexual problems. In some cases, these medications can also increase the risk of developing sleep disorders, anxiety, and dependency. It is important for patients to inform their doctor if they experience any of these side effects and to follow the doctor's instructions regarding dosage and medication use. Additionally, some medications for anxiety and depression can cause sexual side effects, such as decreased sexual desire or difficulty achieving or maintaining an erection. If these side effects are a problem, it is important for the patient to speak with their doctor to discuss other treatment options. Side effects of chemotherapy for cancer treatment. Chemotherapy is a commonly used treatment in the fight against cancer. While it can be effective in destroying cancer cells, it can also have significant side effects and health risks. Among the most common side effects of chemotherapy are fatigue, loss of appetite and weight loss, nausea and vomiting, hair loss, memory and concentration problems, infections, skin and nail problems. In addition, chemotherapy can have long-term effects, including damage to the heart, kidneys, liver, and lungs. It can also increase the risk of developing other types of cancer. Chemotherapy can also be dangerous if administered incorrectly or in incorrect doses. It can affect healthy cells in the body, leading to serious health problems. Patients receiving chemotherapy also have a higher risk of infections because their immune system is compromised. My advice is to continue seeing your doctor regularly if you have had any type of benign or malignant tumor for the respective examinations, but try natural remedies first because the body has the virtue and ability to self-heal if we give it the necessary oxygen, fuel or remedy. Diet, exercise, sufficient hydration, water and exercise oxygenate the body, intermittent fasting or autophagy, contact with the sun and nature, green juices, meditation, and prayer. For more information, I recommend my book, How to Cure Cancer and Other Diseases, or any other book on natural medicine. Unfortunately, doctors are not authorized to tell the patient the truth about the risks and the slim chances of saving or prolonging a cancer patient's life because they are required to report the case and recommend chemotherapy as the only solution, otherwise, they would lose their license. The healthcare system is corrupted and responds to the interests of the pharmaceutical industry because it is under the umbrella of it. This is a hidden truth that few want to acknowledge. Your doctor can be your executioner, using the methods learned from modern science to suggest that your life is over, that your days are numbered, and that only chemotherapy can save you or extend your life a little. Inform yourself, take courage, and do not settle for human methods. Seek God, pray, meditate, and change your lifestyle to reverse any condition or improve your health. Conclusion. The side effects and adverse effects of medications can be severe and even jeopardize the health of patients. It is essential for patients to inform their doctor if they experience any side effect and to follow the doctor's instructions regarding dosage and medication use. It is also important for doctors to carefully consider the side effects and adverse effects of medications when prescribing them and to explain to patients the potential risks and benefits of their use. Patients should also inform their doctor about any other medical conditions they have and any other medications or supplements they are taking, as these can interact with the prescribed medication and increase the risk of side effects. Furthermore, it is important for patients to maintain a healthy diet, exercise regularly, and maintain a healthy weight, as this can help reduce the need for medications for many medical conditions, including high blood pressure, high cholesterol, and diabetes. Nutrition. Good nutrition and a proper diet are essential to prevent the imbalance of the body that can lead to various diseases. Moreover, good hydration, physical exercise, contact with nature, spending a few minutes in the sun, and living a stress-free life can also help reverse such diseases. The best breakfast is one that provides you with the necessary nutrients to start the day with energy and keep you satisfied for several hours. Some healthy breakfast options include scrambled eggs or omelette with fresh vegetables, cooked oatmeal with fruits and nuts, Greek yogurt with fruits and granola. Fruit smoothie with spinach and protein powder. Whole grain toast with avocado and tomato. French toast made with whole grain bread and eggs. It's important to include a good source of protein, complex carbohydrates, and healthy fats in your breakfast to maintain a steady energy level throughout the morning. Also, make sure to choose natural, unprocessed foods. The best lunch may vary depending on individual preferences and needs. However, a healthy and balanced lunch should include lean proteins, complex carbohydrates, healthy fats, and a variety of vegetables and fruits. For example, one option could be a salad with leafy greens, tomatoes, cucumbers, avocado, grilled chicken, and a lemon and olive oil vinaigrette, served with a portion of brown rice. Another option could be a chicken wrap with avocado, lettuce, tomatoes, and a healthy sauce like hummus or Greek yogurt, along with a portion of fresh fruit. It's important to remember that each person has different nutritional needs, and it's advisable to seek the advice of a healthcare professional to create a personalized meal plan. The best dinner is one that adapts to your nutritional needs and personal preferences. However, some general recommendations for a healthy dinner include a serving of lean protein, such as chicken, fish, tofu, or legumes. A serving of vegetables, preferably raw or lightly steamed. A serving of complex carbohydrates, like brown rice, quinoa, or sweet potatoes. Limiting the consumption of saturated fats and added sugars. Avoiding processed and fried foods. Keep in mind that dinner should be a light meal since the body is preparing for nighttime rest, and the digestive system slows down. Carb-free diet. If you follow a carbohydrate-free diet for 7 to 10 days, your joints will feel great. Let me explain why. When sugar is in the bloodstream, it needs to go somewhere, and typically, it goes to our cells, which use it for energy. However, if a cell becomes full, it will block more sugar from entering that cell, and we call this insulin resistance. When sugar leaves the bloodstream and can't enter the cells, it remains in a space between blood vessels and cells, bringing water with it. While it sits there, sugar starts attaching to proteins because that's what sugar does. When sugar starts attaching to proteins, it does so predominantly with the most abundant protein in our bodies, called collagen. Collagen forms the capsule that surrounds our organs, muscles, tendons, ligaments, and, of course, our joints. As sugar attaches and damages the collagen, our immune system tries to repair it. But to do so, it uses calcium. Over time, it will begin to form spurs where this process has occurred. After years of this process, you start feeling pain and stiffness in your joints. Your doctor will order X-rays and see these spurs forming on your vertebrae, tendons, fascia, and joint capsules, and they may recommend knee or hip replacements. When you remove carbohydrates from your diet for just 7 to 10 days, not only does sugar disappear from that space, but water goes away with it. This leaves you with improved joint mobility, less stiffness, and reduced inflammation. Closing remarks. Health is one of the most important pillars of our lives. Without it, our quality of life is significantly affected, which can have serious consequences on our happiness and well-being. For this reason, it is essential to lead a healthy and balanced lifestyle that allows us to prevent diseases, health disorders, and imbalances in the body. To begin with, one of the fundamental keys to maintaining good health is to have a balanced and healthy diet. Food is the primary source of energy for our body, so it is essential to consume a diet rich in nutrients and vitamins that enable us to maintain a strong and healthy immune system. This involves eating a variety of foods, including fruits, vegetables, proteins, healthy fats, and complex carbohydrates. Additionally, it is important to reduce the consumption of processed foods, refined sugars, and saturated fats, as these can increase the risk of chronic diseases such as diabetes, hypertension, and heart diseases. Another essential aspect of maintaining good health is regular physical exercise. Exercise not only helps maintain a healthy weight but also reduces stress, improves sleep quality, and strengthens the heart and muscles. It is recommended to engage in at least 30 minutes of moderate physical activity per day, such as walking, swimming, or cycling. It is also important to incorporate strength and resistance exercises to maintain good muscle tone. In addition to a healthy diet and regular physical exercise, it is important to lead an active life and reduce sedentary behavior. Prolonged periods of sitting increase the risk of chronic diseases such as diabetes, obesity, and cardiovascular diseases. Therefore, it is important to take active breaks at work, walk instead of using a car whenever possible, and engage in physical activities such as dancing or sports. The importance of sleep is also crucial for maintaining good health. Sleeping for 7 to 8 hours a day allows our body to recover and regenerate, helping to reduce stress, fatigue, and depression. Furthermore, getting enough sleep helps maintain a strong and healthy immune system. Another important aspect is stress management. Chronic stress can seriously affect our health, increasing the risk of heart disease, depression, anxiety, and sleep disorders. Therefore, it is important to find ways to reduce stress in our daily lives, such as practicing relaxation techniques like meditation, yoga, or Tai Chi, or simply making time for activities we enjoy. Finally, it is essential to remember that health is not only about physical well-being but also mental and emotional well-being. Maintaining good mental and emotional health is fundamental for our overall well-being. This involves seeking support from friends and family, seeking professional help when necessary, and working on self-awareness and personal development. In conclusion, leading a healthy and balanced lifestyle is fundamental for preventing diseases, health disorders, and imbalances in the body. To achieve this, it is important to maintain a balanced and healthy diet, engage in regular physical exercise, reduce sedentary behavior, get enough sleep, manage stress, and work on mental and emotional health. Additionally, there are other habits that can help maintain good health, such as avoiding tobacco, alcohol, and drugs, limiting exposure to toxic substances and pollutants, maintaining good personal hygiene, and avoiding contact with sick individuals. On the other hand, it is important to have regular medical checkups to detect possible diseases or health disorders in a timely manner. It is also essential to follow the recommendations and treatments prescribed by healthcare professionals, as this can prevent complications and effectively treat diseases. In summary, maintaining a healthy and balanced lifestyle is essential for preventing diseases and health disorders, and for improving our quality of life and well-being. By making small changes in our daily lives, such as consuming healthy foods, engaging in regular physical exercise, and reducing stress, we can achieve a healthier and more energetic life. Additionally, seeking support from friends and family, seeking professional help when necessary, and working on self-awareness and personal development can lead to a fuller and happier life. 6 Steps to Living Free from All Diseases. The body is a perfect system, but often the owner is ignorant and due to ignorance, contaminates it, neglecting their health. Life and health are related to movement, and this movement is produced by metabolism, which generates the body's energy. The following is the perfect formula for caring for our metabolism. Drink enough water. How much water do you need? Divide your weight by 16, and you will get the number of ounces you should drink. Sleep well. The best time to go to bed is around 10 p.m. to wake up early unless you've had an exhausting day or week and can afford to sleep for more than 8 hours until the next day. A tip to help you sleep well is to expose yourself to morning sunlight without staring directly at the sun. Just look out the window for a few seconds, and your body will set its biological clock. As the night hours approach, your body will tell you it's time to rest. If you wake up before dawn, immediately turn on the light in your room or wherever you're sleeping. Don't try to search for things in the dark if the light bothers you. Light will help you wake up, activate your whole body, and give it the energy it needs for the day. If you work at night, sleep enough during the day, isolating yourself from external noises that disturb your sleep but avoid sleeping pills. Deep, uninterrupted sleep of 6 to 8 hours makes a significant difference. Your health is as good as your sleep quality, and vice versa. Exercise. First, you should acquire the necessary energy through proper nutrition and hydration, and then you can engage in physical exercise. This prepares your metabolism to have the energy to perform physical exercises. If your metabolism is weak and slow, you'll feel tired and won't have the necessary energy for exercise. The more idle or sedentary a person is, the more prone they are to illness. This also applies to animals. Keeping a sedentary pet at home is raising it to be sick because it develops a weak metabolism. The science behind this is that physical exercise activates the lymphatic system, responsible for filtering everything that enters the bloodstream through white blood cells contained in the lymphatic system ducts. It is responsible for removing viruses and bacteria that have been defeated, disposing of waste proteins, disposable fats, and any infections. As the only thing that keeps the lymphatic system active and in good working order is movement, physical exercise is the only solution. When the body develops cancer cells due to nutritional, physical, and emotional stress from an unhealthy lifestyle, these cancer cells spread through the lymphatic system when it swells. Balance your nervous system. The nervous system has two parts. One side is called the sympathetic, which wakes us up, alerts us, energizes us, and accelerates us. The other side, the opposite, is called the parasympathetic, which leads us to rest, relax, digest, repair, calm down, and enjoy life, among other things. One of these sides usually predominates in our body. All diseases occur when our body is either too excited or too passive. Most cancers occur when the nervous system is too excited, typically in individuals who tend to sleep poorly, wake up tired, have tense bodies, and frequently experience back pain. They are lovers of sweets and coffee. They tend to suffer from high blood pressure, arthritis, accumulate abdominal fat, constipation, and anxiety, showing nervousness. When the sympathetic side predominates, it causes the immune system to block, exposing it to attacks by the Candida fungus, which can lead to tumors. However, when the parasympathetic side predominates, it can also cause a certain type of cancer of the immune system, such as leukemia, lymphoma, or bone marrow cancer, according to the findings of Dr. William Kellis. To prevent cancers or autoimmune diseases, reverse them, or cure them, we must first identify which side predominates in our body and then start balancing or equilibrating it. How to identify when the sympathetic system predominates? If you have difficulty digesting red meat, eating saturated fat or fatty foods causes digestive problems. Eating any food at night affects digestion, and you wake up with the taste of that food in your mouth. If you also have trouble sleeping, you have a light sleep, and any noise can wake you up. If you identify with these symptoms, you must take immediate steps to balance your nervous system. This includes eliminating red meat, staying hydrated by drinking water and green vegetable juices, consuming magnesium and potassium, both of which calm the body. One reduces excitement, and the other promotes relaxation, daily exercise, catching a few minutes of sunlight, very important, grounding by walking barefoot for a few minutes, and deep breathing. Deep breathing introduces a lot of oxygen into your body, which calms you and sends a powerful signal to your nervous system to relax. After doing these 5 or 6 times, you'll experience a yawn, signaling that the passive side has been activated. Acquire new cells with the right diet. All cells in your body have a lifespan, growing old, and dying naturally. Your body regenerates using new cells. If you give your body garbage, sweets, bread, flour, excessive carbohydrates, etc., it will be rebuilt with garbage instead of the correct material. It's like constructing a house with mud instead of bricks and cement, metaphorically speaking. Set goals, help others, and avoid toxic people. Life has a purpose, live it, make plans, accomplish goals, enjoy it, and help others. Avoid negativity and things that do not favor or edify you. Did you know? You can brush your teeth with coconut oil and moisturize your skin with just bananas or honey instead of toothpaste with fluoride and other toxic ingredients. There is no shampoo like baking soda, and no conditioner better than vinegar. Boiling water leaves your hair soft and shiny, and there's no hair mask like egg yolk. You can lighten your hair with chamomile tea, darken it with walnut shells, cover gray hair with potato peel water, or slightly lighten brown tones with a cinnamon, lemon, and honey mask. You can wash dishes, floors, and windows with citrus peel water. A mixture of alcohol, hydrogen peroxide, and vinegar is a powerful antifungal agent, as is oregano oil, baking soda, garlic, or coconut oil. You can make your own antibiotic using garlic, vinegar, and honey. To live well, you don't really need much. To get out of the system doesn't mean fighting anyone. You don't need to be a pariah who can't fit into social life. You can achieve a lot with very little, just by realizing that you choose how. The author's biography. Milco Baute Lopez, a Cuban writer, editor, and educator of international acclaim, has woven a fascinating trajectory over the decades. His pen, infused with passion and creativity, has been a beacon of knowledge and artistic expression since 1992 when he began enlightening the world with his insightful articles. The most significant chapter of his life was written on December 10, 1995, when Milco crossed borders and oceans to settle in the United States. This land of opportunities became his new home, and in 2001, with a profound sense of belonging, he embraced U.S. citizenship, merging his Cuban roots with his love for cultural diversity. The pursuit of knowledge and wisdom has always been a constant in Milco's life. This passionate autodidact, eager to nourish his intellect, embarked on a remarkable academic journey. He studied philosophy through an online course offered by the University of Edinburgh in the United Kingdom, and in 2016, he successfully completed his academic journey, becoming a graduate of this venerable institution. Milco Baute is not only an accomplished writer but also a prolific author. From 2008 to the present, he has given life to more than 80 books, showcasing his literary talent in both English and Spanish. In addition to his personal work, Milco plays a pivotal role in the publishing industry as an editor, writer, and distributor, collaborating with other authors to bring their stories to the world. One cannot fully grasp the rich palette of Milco's experiences without mentioning his technical background as a graduate in Cuba in 1986 as a technician in electrical power systems. This distinguished profession led him to practice his craft with skill for over 2 decades before his passion for writing and education led him down new paths. In summary, the life of Milco Baute Lopez is a symphony of creativity, perseverance, and dedication. His journey from the Cuban shores to the borders of the United States, through academic exploration and prolific literary production, is a testament to his unwavering spirit and commitment to cultural enrichment and knowledge in all its forms. Audiobook created by Baute Production Publisher. Tampa, Florida, United States of America. Telephone number, 813-693-8879. Email, authors@usa.com. Table of Contents. Preface 7. Introduction 9. Viruses 11. Hereditary diseases 17. Congenital diseases 19. Deformities 21. Obesity 23. Insulin resistance 25. Diabetes 27. Stress 31. Nervous system 35. Nerve diseases 39. Inflammations 43. Arthritis 45. Bones 47. Muscles 49. Skin 51. Eyes 57. Ears 59. Mouth 61. Circulatory system 65. Leukemia 67. Heart 69. Lungs 71. Colon 73. Stomach 77. Liver 83. Kidneys 85. Scalp 89. Baldness, alopecia, 90. Testosterone 93. Ovaries 95. Cancer 97. Adverse effects of medications 99. Nutrition 105. Closing remarks 109. Author's biography 117.